Hey Ben, how are you?
Good. How are you, Indu?
Good. That scar looks like it's healing super well.
Mm, it is, isn't it?
Yeah.
The blood's almost gone, but it's still going to be a while. And I was told that there will probably be something visible for quite some time. So good thing I'm not too vain of a person, but yeah, it looks like I'll be stuck with this for a little while, anyways.
Cool. And your hair is growing back and all that good stuff. So how have you been? It's been a month and a bit since the surgery. And did you get programming this week?
Yes, 2 days ago I got my programming started, and it was the beginning of a long, long process that is going to take us well into probably August before it is actually completed. But I'm feeling pretty good. Although yesterday, I should say, I was feeling like crap. So maybe it's part of the waves, who knows? But the programming was quite the experience. Happy to dive into that as much as you want, but is there anything else you wanted to know before I started just rambling on and on about that day?
Well, I know you were looking forward to the programming, and I think your state of eager awaiting has been, seen. I think by me on social media and some of the things you've posted. You're like, this programming can't come too soon. So I think, how was that month of waiting? What was sort of your sense of that?
Looking back on it now, it was tough. It was bad, but it was bearable, I guess. I'm glad that I'm glad that I basically took the whole summer off and said I don't want to do anything until process is complete. If I had to work a job or do anything really, if I had any real responsibilities in life, which I'm glad I kind of don't right now, then it would have been very tough to balance anything. And that's part of, I think, what makes DBS so tricky. You really need to dedicate a large chunk of time to doing nothing except focusing on your recovery and making sure that you do everything that you possibly can to make sure the outcome is as good as you want it to be. Because if you're juggling a work and kids and whatever else it might be, I don't see how you would get the full benefit from the DBS afterwards. Like there's so much that goes into it. You really need to be mentally clear and you need to have your time clear. You need to just be willing and able to do nothing for a while, to let your body heal and to let everything adjust and adapt. And also going forward, I can see it right now just from the first programming session that it's far from over. There's going to be all sorts of ups and downs going forward. Um, but I'm really glad that I took the time to dedicate myself to just this and nothing but this, really.
Uh-huh. And how has it been? Luckily for you, you also have amazing support networks, right? So you have a really good team of doctors and multidisciplinary team with a whole bunch of people in that hospital that you had the surgery. But then also you have your family that's been right by your side as well. I think you told me. So tell me about the importance of that social support for you.
Yeah, it's been incredibly important to have like my parents were, like you said, they like to dote on me, especially my mom. So they've been very welcoming, very open to just if I need something in the middle of the night to yell at them and say, bring me some water, bring me whatever it might be. Also, yeah, having the stability in place as well, so that I don't have to at this moment work. I can take the time off, and just having that support structure as well. And then on top of that, I also have some additional benefits as well. Like yesterday or earlier this week, a friend of mine came back from Cincinnati, and she's actually a movement disorder specialist herself. And she actually brought me to my appointment with Dr. Fasano and has been helping me as well get through this. So having all sorts of you really want to just surround yourself with as many people as you possibly can. I was actually just talking recently to another friend of mine who's about to go through DBS, and I was telling him how important it is to have somebody in your home that can assist you in whatever you might need afterwards, because you have no idea what kind of state you're going to be in. You have no idea how independent you're going to be. So it's very important that you make sure that you have somebody there that can do all the mundane routine things you might not be able to think of right now for you if you need them to.
Yeah. Yeah, I think that's good advice because I think for us as clinicians who are trying to help pick the right patient type of person who can go through this surgery successfully, I think that having that social network and social support is actually really, really key, and something that I definitely try to ask for. And if it isn't existing already, then, I think then we try to find some mechanism to put in place, whether it's admitting somebody to some sort of place where they have some supervision or whatever it is. But it is definitely a time of transition. And I think that, like you said, taking the time, making sure you go through, it's an elective surgery. So you want to, get all your ducks lined up. So, so yeah, I know that one of the things that you were worried about was that you were going to become a different person with this stimulation, and that your personality would change, who Ben is in the world would change. So tell me about, that first programming session, and sort of what you're feeling now.
So in some ways I was right, in some ways I was wrong. Like physically, I feel a little bit different, but not totally different. There's one like aspect of this that I think I'm still a little bit confused by, or I don't know if I have enough clarity on. So I was told beforehand, not only by my neurologist, but in all the literature, it seems, they say that the optimal settings feel pretty similar to what like levodopa feels like at its optimal level. And I would say, while that's kind of true, it's also very much not true. There's some aspect to that, like in terms of like some motor symptoms, some of the ways that you can control yourself at your best levodopa dose is the same, but it doesn't feel anything like levodopa. Levodopa is a very, very different feeling. Levodopa is almost, I remember especially when I first started taking levodopa, like 5-6 years ago, it felt like almost mildly like getting high.
Yeah.
Like it is like this wave of euphoria that kind of washes over you, and then it goes back, and then it comes over you, and then it goes back. And I remember being like very like walking down the street on Queen Street actually, and like stopping and talking to homeless people suddenly, and like chatting, like being very verbose, suddenly just wanting to like express myself to the world and all that stuff. Yeah, like I said, it's mildly, almost like a mild ecstasy trip or something. I don't know.
Yeah.
But DBS is not like that at all. The simulation that I'm feeling right now, it's like a constant hum of something. And there's a part of it I haven't found a way to articulate yet, but there's like, I feel like there's a presence almost in my chest on some level. Like, not that I feel pain or anything, but there's like, I can feel something else that's like, maybe this is all in my head. Maybe I'm imagining all of this. I don't know exactly. But it does feel like there's something else driving me within me. And there very much is. So I don't know if it's, how much of that is psychological, how much of that is neurological.
Yeah.
And I mean, probably the truth is it's somewhere in between, because psychology and neurology are so intertwined.
Yeah.
But I have no idea if I answered your question. I don't even remember what your question was, to be honest, but
yeah, no, I kind of was just quoting something that you said to me, which was your fear of going into this in the first place was that you were going to change, that the, electricity or the bionics of it all, and, you'd become like a robot, and that you were a bit worried that the real Ben was going to be lost in the shuffle. And obviously it's very early too. So I think some of what we're talking about is just your initial sense of that first programming session. And I know a lot of times we go through things, test things, see what, the optimal contacts are, and then we kind of put things back at a very low setting. So I'm assuming that you're, at low settings now, and certainly haven't had replacement of your levodopa. And I think, to answer that question about what levodopa does versus this type of thing, I mean, I think we don't fully understand how DBS really works. I'm obviously not a DBS expert, but I think we sort of happened upon all of these sort of things in some ways by surprise, where the target should be, what we should be doing, a lot of experimentation of high frequency, low frequency, and these different sort of combinations of electrodes. So I think it's a lot of trial and error, and we don't have, an absolute sense of everything. But I think what many of us as neurologists feel is that levodopa certainly, is a chemical that is missing in not just this one circuit that we're trying to stimulate in Parkinson's. And so those chemicals, that are replaced can affect many systems. And so, and also the non-motor aspects too. So I think when people quote how you're going to best do, I think what the sort of gold standard line is that we can't get you any better with your motor symptoms, at least, then, you're best on with levodopa. And I think that's setting, a standard, like if you have a tremor and this is how much you get better, or if you have stiffness or slowness and this is how much you get better. We sort of do an exam in the off state. So you're not taking your pills overnight. You come in and sometimes we take a video and say, here's how you look, off of your medicine. And then now we give you a pill of levodopa. An hour later, we ask you, is it working? And then we sort of re-examine you. Sometimes we video you there, and that's the on state. And we do the Unified Parkinson's Disease Rating Scale, especially the motor stuff. And what I think most trials have said is that those motor things are the same after, best stimulation parameters have been achieved, that we don't get any better than the best on with levodopa, at least to set sort of an expectation that's reasonable for the patient. Sometimes, things are different. And certainly I think we've talked about the fact that I think dopamine is one also chemical that is modulatable, but I think in Parkinson's, people talk about serotonin, the cholinergic systems. There's a lot of other things that are also happening. So I think you're right that, it'd be very hard to replace all these different pills and chemicals orally that we're taking that's going to your whole body through the blood system by just sticking an electrode in and stimulating. But, obviously, I think that's sort of what the expectations are that we give. So how have you felt so far? Like, what was the initial sort of, I know you said you had some transient improvement after the surgery, like with certain things, and that you could move your hand, I think, a little bit better on day 2 than you had in a long time. So what is, since 2 days ago, what have you felt?
So I felt a lot of things. So I guess starting with the programming day itself. So you ride all sorts of waves on that day because they take you through each contact point on that end, and they stimulate it up and down, up and down, up and down. They grow that field a little bit bigger and a little bit smaller. And it's just an experiment to see where your right levels are really. And through it all, you're sitting in a chair, and I was, I don't know if I can say this. I'm not going to say that part of it. So there was a lot of people there as well for various reasons. And so everyone was just kind of staring at me as my doctor was fiddling with his tablet and adjusting the parameters and making sure that, and seeing my reactions. And through it all, I was feeling all of that as well. So it's kind of a odd experience to be, the center of so much attention, and then also trying to feel what you're going through as well. Not to say that that was bad in any way. Maybe this says a lot about me, but I kind of liked it. But it was hard to get a sense of what was actually happening as a result of the stimulation, what was actually happening as a result of like some kind of psychosocial pressure that I was feeling.
Yeah.
I think my neurologist did a good job, and this is something that one of the parts is it's the real beauty of this procedure is that he can fake it. He can pretend to be pressing buttons and say, "Oh yeah, turn your stimulation on," and then not do that.
Oh wow.
And it's actually a very useful technique for also figuring out if your patient has developed any form of functional disorder as well. And I've noticed, I don't know if you just heard, so one thing I've noticed is that sometimes I feel a little bit of a weird vocal sensation. I don't know if that's dysarthria or the early signs of dysarthria, but I do notice that if I speak for long-winded periods of time, there are weird things that happen to my vocal cords and my jaw. I don't know if you were able to detect that, but I felt it anyways. But anyways, getting back to what I was feeling. So that day went, I enjoyed the whole procedure, but then after I came home, one thing that was tough is that being off your medication for that long is pretty tough. And I could feel the effects of it as well. So I could feel why it's so important to not just cut off your medication. Also, after I came home, I started to become pretty dyskinetic once the medication did start to kick in again. That lasted for a long time, and it lasted until the next morning as well. And then throughout all of yesterday, I felt I had like a splitting headache. I felt nauseous. I was just lying in bed doing nothing really. Then I took some Tylenol PM and I zonked out for about 12 hours, and I woke up feeling amazing. I woke up feeling really, 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 really good. my DBS is still on a very low setting. Over the next couple of weeks, we're just going to be slowly tweaking up the parameters. But it's left me right now feeling like my baseline, my off is it's almost has me stabilized at this point, which is actually much better than what I felt in the clinic. And this is another tricky part of DBS. What you experience in the clinic and what you experience in real life are not the same thing. And I don't know how doctors actually try and go about doing this, but the level that you tweak things to in the clinic is not going to be representative of what the patient needs in their real life scenarios.
Yeah.
I'm sure my doctor is well aware of this as well. I wonder how is it taught, or how is it thought of to actually try and compensate for that difference in real life versus clinic?
I mean, like you said, the clinic experience is kind of artificial, and I obviously haven't been through what you're dealing with, but at the same time, I almost picture going to the eye doctor, when they ask you for your lens prescription, they're like number one, number two, number three, like, and you're just like,
they look the same.
I'm like blinking, and then I'm like, is it because I blinked, or because I was it one or was it three? And I don't want to get the wrong pair of glasses and go home. And, so, but, they're all so similar. And then you can kind of psych yourself into thinking like, maybe one was better. Maybe I don't even need glasses, but because there's a lot of moving parts, even with something like that, obviously. So I think, when you think about all the people looking at you and then you're trying to feel things and report them, I mean, of course, there's a huge amount of, subjectivity, and then people are relying on that report. And luckily you'll be going in and getting tweaked on a pretty regular basis. But, some people who live far away, they're going in once in 6 months. Sometimes, I mean, I think the center that you guys are near, they take patients from all over Canada, right? So there's sort of this need to kind of figure it out very quickly, and then try to make sort of a setting parameters sort of flexibility. And luckily now the patient sometimes can do some programming themselves, and sometimes there's some remote options. But, there's, I think, a balance, and I've been doing this long enough where we didn't have, multiple settings that we could put people on, and they could either turn it off or keep it at whatever stimulation. And you were just like, you got what you got, and you didn't want to do something so aggressive and then send somebody driving out 3 hours away and then having them to have to come back right away to change it. So I think we're very lucky in the technology that we've been able to kind of follow along with. And I think, that real life setting versus clinic is obviously, very artificial. And I think that's like for anything, right? We've talked about when we had Sarah Ragara come on about, your doctor sees you for this 15 minutes once in 6 months, and these are the rest of the time. So I think, again, sort of, is there ways to wear wearable technology or track something, or, ultimately what really matters? Because it may not be the tremor, it might be just your quality of life, right? So, you might be so much better motorically, but then if you aren't feeling that well from a mood perspective, or some of these other chemicals, like we talked about with dopamine, can affect sometimes mood, sometimes elation. And if you withdraw it, you can actually feel the opposite. So you can sometimes go through sort of a withdrawal that can make people depressed and anxious and stuff. So I think it's really this balance. And I think that's why we try to make small incremental changes over time, give people a sense that it's going to take 6 months, so that they're not rapidly trying to, do too many things too quickly. And then since you've been on these medicines so long, we can't take them away so quickly. So we also have to balance sort of like the increasing stimulation and possibly decreasing medications as well. And let me ask you, Ben, what was the location of your DBS? Like, what part of the brain is it in?
The subthalamic nucleus,
Okay.
the STN.
Okay.
So I had the option of the STN and the GPI, and me and my doctor walked us through benefit, like weighing the advantages and disadvantages of both. And in the end, we chose the STN. I think that was the logical choice for me.
Yeah, for you and your age group and your symptoms and things makes a lot of sense. Absolutely. So, did you have any side effects? Do you feel so apart from that sort of weird feeling of something possessing you or changing you? What are there any sort of physical side effects that you've noticed or that your family's noticed?
So I mentioned this a little bit before, I felt a little bit of, I don't know if it's dysarthria or something else, a little bit of, sometimes I have trouble vocalizing certain words.
Is it actually in your vocal cords? Because you point here. Is there pulling in your mouth, do you think, or what?
Yeah, it feels like it's here. So maybe it's not
my vocal cords at
The
all.
vocal cords are back, inside. So you probably wouldn't feel some, you might hear it, those are those cords that are doing this. But sometimes there's muscles in these areas that can sometimes get a bit tight.
And is dysarthria here? Where's dysarthria take place?
Dysarthria just means that you can't coordinate your speech well. So it can come from various things. So it can sometimes be a vocal cord thing. It's as opposed to like an aphasia, which is basically you can't sort of come up with what to say. The dysarthria is sort of like the mechanism of speech production with the muscles and the vocal, all this area. So it's not exactly one specific muscle group or whatever. So
okay. Well, otherwise, I haven't felt too many side effects. Although yesterday, all that sickness that I felt, the headache, the dizziness, the nausea, I have no idea what to attribute that to. That might have been some kind of weird side effect. I might have just been randomly sick, who knows? But
did you change any of your medicine on that day that you got programmed? Or did they reduce anything, or it's just the same?
no, we didn't change any of my medication. The only thing that changed was that I was thrown off of my rhythms because I had to wait to take my first dose until after we started the programming.
Right.
So that might have done it. Also, like I was in a hospital setting, I might have picked up something, some germ or something, who knows? I might have just also randomly gotten sick. So it's hard to tell. But right now I feel much better.
It's also a lot, right? Like, I mean, having all these people watch you and there's a lot of pressure. And so maybe your body's just like, hey, I need a day to just chill out and recuperate, which it's good that you listen to your body. I feel like you're pretty in touch with sort of what you need. The other thing that I will point out just randomly is that Tylenol PM has, at least in the US that I know of, has Benadryl in it, which is, can affect, cholinergic systems and sometimes can make people sedated and other side effects. So definitely, I wouldn't recommend it in general to Parkinson's patients, especially if you're older. But, I think Ben, it sounds like you maybe had felt better on it, got a good night's sleep. And maybe that other chemical that is in that maybe helps you a little bit. I don't know, with some of the symptoms. But it can cause a lot of side effects too. Sometimes confusion and dryness and all these sorts of things. So we tend, especially in older people, and I know our geriatricians here at UCLA have been like, that stuff needs to be taken off the market, because a lot of our patients just, they're like, oh, it's just Tylenol and I take it in the PM, otherwise it's the same. And it's like, no, it actually has some other ingredients in it. So it is interesting.
Yeah, I've heard, and I'm very wary of that as well, but I just get so much benefit from it, from the sleep that I get, and that day in particular, I just felt so horrible that I needed to take it. I felt.
Yeah, you sort of take it rarely. Yeah, that's probably good in your age group. But so it sounds like you're trying to, focus on sleep. You're trying to focus on sort of your sort of self-care as well. How's your exercise stuff coming along?
I haven't been able to get back to exercising yet. I just haven't really had the energy or time for it right now. Hopefully this afternoon I'll be able to. Actually, I just went for a short walk, and it was interesting. It's kind of cool just to be able to walk again. It's kind of cool just to be able to, even at breakfast, trying to manipulate my spoon and my fork and kind of in some ways relearning how to use them properly. Because usually when I would eat, I would have to make sure I was off my medication, because when I'm on, I'm too dyskinetic.
Oh, okay.
To use it properly.
Okay.
So now when I'm off, my off is a little bit better than it was before. I have much more control over, I'm off right now. Okay. I have much more control over my hand than I used to. Okay. So I feel like I can use a spoon properly now.
Okay.
But I don't remember how to use a spoon properly. So I was like, does the handle go between these fingers or these fingers?
Yeah.
And I was testing and experimenting. One other thing I wanted to mention quickly before we go, because we're gonna have to jump off in a second.
Yeah.
You asked me before what else has changed. One of the kind of social aspects that's changed is interacting with the rest of the world and other people in the world. And also you asked what about Ben might be different, what about myself might be different. Well, you kind of get a sense of yourself through how other people see you. Right. Your awareness of yourself is kind of built up through your awareness of others and how others perceive you. And in that, I find it a bit strange, because this part me, part DBS. How do I put this? It feels like, so I've always been kind of bad at small talk. I just find it kind of like, yeah, I just usually just want to push past that and let's talk about something a little bit more interesting.
Uh-huh.
Now I can't handle it at all. Like if somebody starts talking about, oh, I went to this restaurant and the wine was good and the food was great, I just zone out so quickly now. I don't know what that is. I don't, maybe it's just the temporary effect of like going through so much so quickly.
Yeah.
But
Well, I think
yeah,
also, I mean, I think the pandemic is slowly, in Canada, I know there's like a huge number of vaccinations, thank God. And my parents are actually in the US now, yay. So I think many things are starting to open up socially as well. And I know that in LA, for example, there's, a lot more social interaction going on and people out. It's a beautiful summertime as well in Canada. And I think, so you're just sort of reemerging from a pandemic that was already kind of fatiguing and exhausting and even, I think isolating. And so the social aspects of having to get back out and have, people that you may not know, and even the small talk, even forget the DBS. I think a lot of people are like, who cares about all this stuff? Or I'd rather I kind of realize I'm better off like just in my own house or, hanging in my own whatever space. I don't really need to be around, it's just exhausting, right? And sort of a little bit of a transition just with the pandemic itself. So I think many, many, many things have happened, many of them good for the world and for you, Ben. But I think, don't overthink it. I think, like that whole, just picture me in the eyeglass chair. What is it, 1 or 3? I mean, ultimately you want to take things in global, chunks of time, a month, 6 months, I think micro analyzing, and I think you're very analytical, every minute of the day, probably not terribly useful, right? So, but I think just enjoying,
that's my brain.
but just, being present, enjoying the moment, feeling the sunshine, enjoying a nice glass of wine at a nice restaurant with your friend. I think all those things are beautiful things that we haven't been able to do. So I think, I think too much analysis sometimes, because the mind and the body are so connected, you can kind of will yourself to think away, right? And I know that you have been working with Dr. Lidstone as well, and she's huge, sort of research goddess of the placebo effect. And it's really interesting because it actually, the sense that you're getting changes in your medicines can actually make the dopamine levels themselves different, right? I mean, they sort of, there's chemical changes that happen just with placebo. So I think just enjoy your time. We'll connect next week and we'll continue the conversation. And you look great. I didn't even realize you were off, to be honest. So I would not have said that just as somebody looking at you through the lens here. But yes, we'll connect and have a great week. We'll see you in next week for further updates.
Thank you. Take care.
Yeah.